Just last week, the physical examination report of U.S. President Joe Biden was released. Among the many test items, President Biden's blood pressure was close to the ideal 120/70 mmHg. Given President Biden's age of 81 years, renowned cardiovascular Dr. Zhang Zhiying advised everyone to view this with rationality and not to indiscriminately imitate it. Although this blood pressure value seems perfect, it is actually not very appropriate and significantly increases the risk of low blood pressure. In real life, not every elderly person around 80 years old is suited to have their blood pressure lowered to such a low level. Even if they can tolerate it, it is crucial to be aware of the potential for low blood pressure. Understanding elderly hypertension. To clarify this issue, we must first understand what elderly hypertension is and its characteristics. 1. What is elderly hypertension? Elderly hypertension is a common chronic disease among older adults, with its incidence increasing with age. According to statistics, more than 50% of people over 15 years old in China have hypertension, making it one of the most common chronic diseases among the elderly. The health hazards of elderly hypertension cannot be ignored. Without effective control and treatment, it can easily lead to serious diseases such as cardiovascular and cerebrovascular diseases, kidney diseases, etc., severely affecting quality of life. Elderly hypertension refers to hypertension in individuals aged 60 and above. It can be diagnosed if the blood pressure is higher than or equal to 140/90 mmHg on 3 different days. Note that if either systolic or diastolic pressure exceeds the standard, it can be diagnosed as hypertension. If both rise simultaneously, the condition is confirmed. 2. Characteristics of elderly hypertension. High systolic pressure and wide pulse pressure. Elderly hypertension often presents with high systolic pressure and a wide pulse pressure. For example, a systolic pressure of 150 millimeters of mercury and a diastolic pressure of 60 millimeters of mercury, with a pulse pressure of 90 millimeters of mercury. This characteristic indicates a decrease in arterial elasticity and vascular sclerosis. Large blood pressure fluctuations. Elderly individuals may experience significant blood pressure fluctuations, often leading to low blood pressure. Blood pressure can be influenced by emotions, seasons, temperature, meals, and body position. Medical data show that the incidence of orthostatic hypotension in the elderly ranges from 20% to 50%, and postprandial hypotension ranges from 24% to 36%. Abnormal circadian rhythm. Many elderly individuals experience increased blood pressure at night, a health issue that is not easily detected. Most require 24-hour dynamic blood pressure monitoring to identify this issue. Elderly individuals with elevated nighttime blood pressure have a higher likelihood of developing cardiovascular diseases later. White coat hypertension. Many elderly people experience elevated blood pressure readings in medical settings, but normal readings at home. This situation is called white coat hypertension. Such individuals also need close monitoring of blood pressure and should not take antihypertensive medications, especially high-dose ones, based solely on one elevated reading in the clinic. Pseudohypertension. Most elderly individuals experience arterial sclerosis due to aging, which causes blood pressure readings to be falsely high. This pseudohypertension can mislead doctors into prescribing more antihypertensive medications, potentially causing genuine blood pressure to drop excessively and leading to significant risks of low blood pressure. Difficulty in treatment. Due to the above characteristics, treating elderly hypertension is challenging. Although high systolic pressure should be actively reduced, care must be taken not to lower diastolic pressure too aggressively, as it could lead to further health risks, such as impaired heart perfusion and myocardial ischemia. Causes of elderly hypertension. Several factors contribute to the characteristics of elderly hypertension. 1. Aging. With aging, the arterial intima thickens and calcium deposits increase, leading to reduced arterial elasticity and increased hardness. Additionally, sensitivity to pressure receptors and beta receptor responses decrease, and renal interstitial fibrosis increases, reducing glomerular numbers and effective filtration rate. These factors make blood pressure control more difficult. 2. Health hazards of elderly hypertension. The main health risks of elderly hypertension include 1. Cardiovascular and cerebrovascular diseases. Hypertension is a major risk factor for cardiovascular and cerebrovascular diseases. Long-term uncontrolled hypertension can lead to atherosclerosis, myocardial infarction, stroke, etc., severely affecting health. 2. Kidney diseases. Hypertension can damage the microvessels in the kidneys, leading to glomerular and tubular damage, reduced kidney function, and potentially chronic kidney failure. 3. Retinal diseases. Hypertension-induced retinal microvascular damage is a common complication in the elderly, severely affecting vision and potentially leading to blindness. 4. Heart failure. Hypertension increases the heart's workload, which, if uncontrolled for a long time, can lead to heart function decline and eventually heart failure. Managing elderly hypertension. 1. Genetic factors. Family history of hypertension increases the risk of developing hypertension. 2. Lifestyle. Unhealthy lifestyles, such as high-salt diets, high-fat diets, smoking, excessive alcohol consumption, and lack of exercise, contribute to hypertension. 3. Mental stress. Chronic high stress can lead to hypertension. Maintaining a positive and cheerful attitude is important for hypertension prevention. 4. Managing blood pressure. For elderly individuals, the key points are 1. Avoiding excessive blood pressure reduction. For those aged 60 to 80, the goal is to reduce blood pressure to below 140/90 mmHg, ideally below 130/80 mmHg if tolerated. For those over 80, aim for below 150/90 mmHg, considering reducing to 140/90 mmHg if tolerated. Avoid over-reducing blood pressure to prevent potential damage from excessively low levels. 2. Avoiding rapid blood pressure reduction. Blood pressure should be lowered gradually, ideally over 2 to 4 weeks, to avoid severe complications like stroke or syncope. 3. Medication. Medication must be prescribed and adjusted by a doctor. Commonly used antihypertensives include 5 major classes of drugs plus prazosin, suitable for elderly patients under professional guidance. 4. Diet. Maintain a low-fat, low-salt diet. Focus on vegetables, fruits, whole grains, and low-fat dairy products, and avoid fried foods, preserved foods, and organ meats. 5. Exercise. Engage in moderate exercise like walking, jogging, or Tai Chi, 3 to 5 times a week for about 30 minutes each time, avoiding overexertion. 6. Avoiding smoking and alcohol. Smoking and excessive drinking increase blood pressure and should be avoided. 7. Weight control. Maintain an appropriate weight through balanced diet and moderate exercise. 8. Regular monitoring. Regularly monitor blood pressure to detect abnormalities and adjust treatment as needed. 9. Managing sleep apnea. Sleep apnea is a significant risk factor for hypertension and can exacerbate blood pressure fluctuations. Elderly patients with sleep apnea should manage it actively. Anal thoughts. In summary, while President Biden's blood pressure of 120/70 mmHg may seem ideal, it is not necessarily appropriate for every 80-year-old. This level of blood pressure can significantly increase the risk of low blood pressure. Therefore, elderly individuals should approach blood pressure management with caution. I hope this video helps more elderly people accurately understand their hypertension and emphasizes the importance of professional treatment and regular monitoring.